All right. Welcome, guys. That was Dr. Alex Al-Sadi. He was on the island with me on CMU, and he's currently an internal medicine resident at Arizona State University. I just spoke with him yesterday. So we had the honor of studying together for all of our board exams. Very blessed. So to introduce myself, I'm Dr. Nav Badesha. I'm a first year resident at Southern Illinois University School of Medicine. I began my journey with CMU um, on the island, MD1, and went through MD1 to MD4. Um, did Kaplan in Chicago, did my rotations in Chicago, applied, matched, and now I'm in my first year. It's been one hell of a journey. I just got off a 24-hour shift not too long ago, so apologies if I seem kind of tired or out of it. It's a long day. I've been doing OB-GYN right now. It's been beautiful. I'm learning so much. There's a shift this week where I got to deliver 5 babies. It's kind of crazy. It's definitely worth it. So for anybody here right now who's going through the struggle, the USMLE struggle, I just want to start off by saying, hey, it's every second of that struggle is worth it once you get into residency because you start getting trained in the way that used to be dreaming of getting trained, right? And it's not to say that the journey is easy. It's definitely one of the hardest journeys I had to take. Um, I usually in my introduction, I tell everybody, a little bit about my story. So when I left the island, I didn't know much. The island did not prepare me, and that was frustrating to me because I thought I knew stuff, and I like go to Kaplan, and like I do so bad on the Kaplan assessment. It was like I don't even know what I got. It was like a 20 or 30%. It was so bad, and then I go through Kaplan. I did the 14 week course, and I realized I didn't really know that much. So, I finished Kaplan. It kind of taught me what I need to know, but it wasn't until I started UWorld where finally started learning, and it actually took me 2 years from when I left the island to be able to fail, I think, 3 or 4 NBMEs at the Prometric Center, and then eventually I finally passed the NBME. Finally got to take step one, pass step one. So that journey was not easy. 2 years of limbo and studying was depressing. There was times I broke down. A lot of students I've been helping at CMU, very, very, very similar situations where, I have a lot of students reaching out to me and they're breaking down and then they're apologizing to me. And I'm like, no, no, no. Like, I understand. I was once there and I know what it's like to feel like you're doing your best, but it's not working out. So, um, lots of things have changed at students for free. So anybody here, my email. You guys. You research. Excited to get started. So that webinar, please Sip on my coffee. I see about half of you guys have began answering the polls. Again, for the other half, just make your way to the polls, start answering the polls questions. It really, really helps me understand who's in here and how far along you are with your studies. So, I'll give it a few minutes. I want everybody in here to be able to answer these polls before we move forward. All right. Again, guys, please make your way to the polls section. That's going to be under the chats. I'll even type it in here. So where you see the chat, that's where the polls are going to be located, pretty close to there. If you go to the polls section, answer the multiple choice questions, it allows me to see where you guys are at currently with your studies, and that will help me kind of base this entire webinar off of where you guys are at. All right, I'm not seeing any other answers, even though there's more people in here. So I'm just gonna get started. We could go from there. So it looks like I wish to pass USMLE in about 2 months is the more common answer. Somebody said 4 months. Did you attend the last webinar? A few of you did. Excellent. You are all CMU students. Looks like you guys are hitting Pathoma at least once or twice. Fastest you've cycled, 3 months, 1 month. Okay. Um, how long after you've been studying for USMLE Step 1? Yeah, I have one of you guys in here for 4 years, a few of you for about a year, a few of you guys for 6 months. Again, I've helped students. I had a student who was studying for 6 years who I knew, and I helped her through the process, and she passed with a pretty decent score now. So, again, it's nothing wrong with you. It's just what you're implementing, what studying strategies you have, and the studying strategies that I'm going to be sharing with you today are the same studying strategy that US med students are using, and it's something that because it's been so successful, tested and proven with hundreds of students. I'm not giving you guys something that isn't tested and proven, so just hang in there. I know one of you guys just said that you been studying for more than 4 years. Hey, man, I understand the struggle, and I'm proud of you for sticking through this far. The goal is to be able to sharpen those edges and to get that proper work ethic and those proper studying strategies. So, you could get out of the step one process and into the rotations, and as far as residency is concerned, even if it takes you a while to sit step one, as long as you're honest, you'll match somewhere, but you want to score well, right? So we'll get a little bit deeper into that. So how many NBME attempts have you had at the Prometric Center? It looks like a lot of you guys have just taken one. And again, it took me 4 Prometric Center NBMEs before I finally passed. So, that man, that was a frustrating time. I kept thinking that I had put in enough work and I hadn't. So, I learned a lot going through that process. Looks like many of you guys are still going through UWorld for the first time. And a few of you have done it more than once. A few of you are in the 100 to 150 range. When you guys are in the 200 range with the scores. Okay. And one of you guys have taken step one before. A few of you haven't. And again, even if you fail step one, I know many people who failed step one and matched. So it's just really about what you're doing and how you're setting yourself up. And that's something that I'd be more than happy to help you guys with. So thank you. That does help me get to know where you guys are at. Usually at this time, I open this up to a Q&A. So submit. So submit questions to me and I will answer them. If you guys, it's near the poll section. If you go to the questions, if you just start submitting questions, I'll just answer everybody's questions. Whatever questions you have, I'll answer them to the best of my ability, and we'll go from there. So, and questions can be specific. They could be about step one. So questions can be about step one, CMU, the match, residency, your resume, you know, any type of questions you guys have. My goal is to advise you on how and what you need to be doing to be able to, you know, successfully pass your boards, successfully submit your applications in the September window for the match, and then successfully match. So, you know, being on the other side, I realize now it's, you know, if you pass all your boards and you do what you need to do, the odds are if you're passionate about what you do, you will match, even if you have low scores, you know. And I didn't know that initially. So there's a lot of stress on my side before it actually happened. And now that, you know, I'm at a university program, a very good program at that, like I'm really gracious for that. And I realized all that hard work paid off, like I was telling you guys, you know. So again, guys, just please start submitting questions. They could be about step one. They could be about step two. They could be about step two CS. They could be about CMU. They could be about the match. They could be about residency. Keep them medically relevant and relevant to your ability to match. And, you know, for those who are submitting questions, you can also vote up questions. So if you like a specific question, you can just vote it up just to make sure that I answer it. But there's not too many of you guys here today, so I'm not even doubting the fact that I'll be able to answer everybody's questions. And here we go. I'm gonna get started. But again, guys, please submit questions. I really want to be able to answer as many questions as possible. We got 45 minutes, so I got an ample amount of time to be able to answer any questions that you may have. So take advantage of the opportunity, submit your questions, vote up the questions you think that would be the most useful. I see Manpreet is submitting questions. Yep, just last question. What is your recommendation? See where, right? Because a beginning stage to studying, there's like the middle stage, and then there's the advanced stage of studying, right? So I need to know if you're in the beginning, the middle, or near the end of studying, because you're going to approach your first aid a little bit differently based according to that. And one of the ways I like to measure whether you're in the beginning, middle, or end stages is how many times you've done UWorld, right? If you're still in your first time doing UWorld, you're still in the beginning stages. Um, if you have, you know, taken NBME and you're like below the 160 mark, you're still in the beginner zone. Um, and you know, if you have already done UWorld more than once and you're above that 160 space, then you're kind of in that middle zone. And then if you've already passed your NBME, then you know you're in that advanced zone where it's like time to really grind it out, right? So um, based on where you're at, it's a little different on how you approach your first aid. I don't know if you'd be comfortable letting me know if you're in the beginning, middle, or end stages. But if you could just type that in there and let me know if you're comfortable doing that, it would help me direct you. It would help me answer your question a little bit faster and easier. And if you're not comfortable doing that, that's totally fine as well. I can kind of answer all of them. So please, I'll give you a second. If you want to answer whether you're in the beginning, middle, or end stages. That should help me answer this question. Beginning stages. Okay, excellent. Yeah. So, you know, when you're just getting started, your main goal is to be able to go through UWorld, right? And the way to do that specifically is at least 40 questions a day, or at least 2 blocks a day. So 1 block or 2 blocks a day, right? And you could do these tutor mode at the beginning, or you could do them times. Times is usually better; it's faster. But if you need time to be able to get through every question, you do that. But you do them subject by subject, right? So when you're doing UWorld as a beginner, you want to start with cardio. You want to do all 320, 330 questions of cardio. And while you're doing UWorld cardio, you want to have your own notes that you're taking, and you want to have your first aid open to cardio. So say you have a question on cardiac pathology related to the rhythm of the heart. It's about atrial fibrillation, right? So if your UWorld questions about atrial fibrillation, you want to make sure that you're writing notes about the things you didn't know, but then also in the first aid, you want to have the atrial fibrillation section with all the other EKGs open. And you want to take time, look at AFib. You want to look at the other atrial, like you have atrial flutter. You have superior ventricular tachycardia. So you have a lot of different differentials in that space that have to do with atrial contraction, right? So you want to be able to look in the first aid after you answer your question and you annotate your notes. So the goal here is, say you do 40 questions a day. It's like 330 questions to be able to do all of cardio. It's going to take you like a week or two to be able to get through all of cardio the first time through UWorld, while annotating notes, while going through your first aid. But the beautiful thing there is, as you go through UWorld, you should go through the entire first aid alongside UWorld, right? So the goal isn't to sit there, read the first aid, and memorize. It's not going to work. There's no such thing as sitting there memorizing the first aid without application. So the beautiful thing about doing a question and getting it wrong or getting it right is you're kind of trying to apply that knowledge, and you're seeing where you're going right and where you're going wrong. So when you're doing that and then you go to a certain section, the first aid, and you're reading on top of that and you're annotating notes, just the amount of retention you're going to have is so much greater, right? So that's the goal. In the beginning stages, you're going to do subject by subject, every subject eventually, right? You go cardio, endocrine, GI, heme, all the way down, every single subject. Do questions in every subject. Make sure first aid's open. Make sure you're annotating notes while you go through it. So this can take some time. It can take up to 6 months to be able to go through everything the first time, but there's no passing step one without it. So, the faster you do it, the faster you sit step one. And the goal now is to have CMU students doing that on the island, because again, unfortunately, the island didn't prepare us as much as we would have liked. So, then you have to do all this preparing by yourself, which, it's not the most ideal situation, but hey, we get into the same programs these US med students do. I'm at a program where half the students here are, half the graduates, med school graduates, are US med grads. And I'm in the same playing field as them, even though I came from CMU. So at the end of the day, just put in the work, regardless of where you came from, right? So that's what I would recommend from the beginning stages. Is you're gonna forget what you do in the first aid if you're just reading it. But if you're doing UWorld and you're going through the questions, you're annotating notes, and you have that part specifically open in the first aid, and you're reading all the other things around it, it'll help you. It'll help it stick a little longer. But again, you're going to be going through all this material so many more times. So, I don't want you to get stuck on like, oh, I got to master this material the first time I go through it. The goal is just get through the material and try to learn something. You know what I'm saying? Because you'll be going through it multiple times. So your first time, just go subject by subject, take your notes, lay eyes on every single page in the first aid, and just like write some notes, and then let it go and keep moving on, because there's a lot more to do, and don't get too caught up in just, I have to master it now, because that mastery comes with repetition, and that repetition means going through the material multiple times, which is going to continue to happen over time. All right. Hope that answers that question. All right. You were answering okay. You were submitting questions as answers. I got you. All right. Good. Yeah, I got a few of you in here saying you're in the beginning stages. Thank you, guys. Keep submitting more questions, because we don't have that many right now. All right. So I will answer Manpreet's next question. And again, guys, for everybody in here, submit questions. Vote up the questions that you want to get answered. All questions can be directed towards step 1, step 2 CS, CMU, the match, residency, my experience in residency, the application process, whatever your questions are. Submit the questions through this question section, and I'll do my best to answer them. All right, and I'm gonna keep going here. Manpreet, how do I learn from UWorld? Do I put the information in the first aid or read and move on? And is it mixed in tutor mode or systemized? Okay, good. Yeah, so I kind of answered this question the first time, right? So basically, as a beginner, your goal is going to be to do UWorld subject by subject, so only one subject. So it'll be cardio, but you do everything in cardio. You know, the embryo anatomy, physio, pharm, biochem, and like everything else, right? You're going to do all that just with one subject, right? You want to do a minimum of 40 questions, and like you want to, or if you could do 2 blocks, it's gonna be a little harder to get through 2 blocks. But again, if you could do your minimum is 40 questions, because it should take you 8 hours, literally, to be able to 6 to 8 hours to be able to do a block and to be able to go over every question, right? So how do you learn from it? Say we do a question, and you pick an answer, and then whether you got it right or wrong, the goal is you have to read the entire explanation, not just the educational objective and the correct answer and then move on. You want to be able to, one of the best things you could do when approaching any questions is first read the last sentence first. That helps you with direction. You know what the question is going to ask. Because sometimes questions have like 2 paragraphs, but then like the questions like what's the mechanism of action of this drug? So literally you waste time reading, 2 paragraphs when you could have just read the last sentence and you wouldn't have even have to read the 2 paragraphs, right? And that would save you time. So on step 1, every block you get 1 hour for 40 questions, right? So timing eventually becomes very important. In the beginning stages is not as important, but you want to make the habits, right? So beginning stages, you just definitely want to be reading the last sentence first, and then reading the whole thing if you need to, and then answering the question. So once you either get the answer right or wrong, you want to know why the incorrects are incorrect, and you want to know why the correct is correct. Because say there's 5 answer choices, A, B, C, D, E. Um, you know, if the answer is B, if they change like the take it that one was here because like if you have videos, and when he did step one questions, or if he has whatever it is, saying Satar says the high yield shows up on the exam every time. So, my recommendation in using these three resources, we call it UFAP, just UWorld First Aid Pathoma, is use UWorld as your centered learning resource, but then use your first aid and annotate your notes. But then also for cardiac path, you want to be able to use Pathoma because he doesn't just hit pathology. He hits a lot of histology. He hits some anatomy, hits some physiology, and some pharmacology. So he gives you a solid review of everything. And, that's when you're starting as a beginner, just making sure that you did the entire UWorld section and allowing that to get you through the entire first aid section, having your own notes, and then doing Pathoma on top of that will allow you to get a little bit of an understanding of what the exams want in that subject, right? And you'll be coming back to it many times because trust me, you're not going to pass it the first time you go through it. As much as you like to think, it just doesn't work that way. Because US Med students, they master the material, so will you, and that takes some time. All right. Cool. So, guys, I'm not getting enough question submissions. I need a little bit more interaction. So please don't be shy. Be interactive for everybody in here. I want you guys interacting with me. In the chat, type out, "Hey, I had a similar experience," or "Hey, like this makes sense," or "This makes no sense. Can you elaborate?" But I need you guys, interacting with me. So, submit more questions, vote up more questions. And we'll go from there. So again, just keep them coming, and I'll do my best to keep answering them. All right. So Manfrey, yep, done UWorld once. NBME was pretty low. Yeah. So again, go through it the way I'm recommending, right? So for beginners, it's going to be doing UWorld subject by subject, at least 40 questions a day, making sure you go through the first aid alongside UWorld, and then also doing Pathoma for that section. And then that's one time doing that one subject. And you should not do less than 40 questions a day because or else you'll take years to sit the exam. It's literally like you have to work at least 8 to 10 hours every day. And you have to develop that work ethic because if you don't, you're never going to pass. So it's just important to know that. All right. Yep. Beginning stages. Very good. Here's Kwaku A. Sorry if I pronounced your name wrong. What do you recommend as the best studying formula to pass the exam for say? Oh, perfect. Yeah. Well, that answers that question, right? Yeah, use all of them, right? So the formula again, it goes back to what I was just saying, right? So if you're using UWorld as a centered resource to learn, you're annotating notes on that, but then you're going through the first aid and you're doing Pathoma. You do the subject by subject, 40 questions a day, just knock it all out. Because after you've done it one time, there's a foundation there that was never there before, and then you build on that foundation. Because the second time you go through it, now you can do timed mixed blocks. The second time you go through UWorld after you've done all the notes, because then you're starting to get into the tempo where it's like, all right, I got to fix my. That's when you get into test taking strategies the second time around, where it's more just timing and like kind of your approach, simplifying it down. But that we'll save that until you get to that point. So as for the beginners, it's pretty simple there. Stick to UFAP. I know I get people ask me about different resources, but I'm not going to recommend any other resources because these have been tested and proven um, thousands of times, right? So I don't want to really give you or recommend a resource that like is brand new and I don't really know anything about it. These are just, I've had students get 240s, 250s using these resources if they're used well. So, again, that's possible for you. Getting 240, 250 is definitely possible. It just depends on what you put in. And eventually you realize what you put in is what you get out. So, when you're putting in your heart and soul, then that shows in the score. And if you're, I think a lot of people feel like I probably won't have to work as hard as I think everybody says, and then it just either never happens or you don't do as well. So it's with that reaction there's a complete opposite. So with the action there's a complete opposite reaction, right? So it's equivalent to how much work you put in. So all right, I hope that answers your question there. All right. I don't know. I think my connection was like lost there for a second, but I'm back. All right. Yeah, keep the questions coming. I see there's a few of you here. Beginning stages. Sorry, I was typing the question. So start first aid with UWorld. Don't read it alone first. Don't ever read the first. I mean, the time you'll read first aid alone, Manpreet, is at the end when you've gone through it. Like you've done UWorld 2 to 3 times. Hussein Sattar Pathoma, his students do UWorld 3 times, and they average 250s, right? So you're not going to be reading the first aid alone until you've mastered already what's in the first aid. Because you going through the first aid just by your lonesome, like it will never give you enough yet, because you don't know how to use that information and to translate that into questions. Because questions, the way they're formulated, they usually have 2 to 3 layers under them, right? So it's not just read this, memorize it, answer the question. That's just not how it works, right? So yeah, definitely the fastest way to get through the first aid the first time is to use UWorld to be able to get through it, you know? All right. Um, Ashun says beginning stages as well. Very good. Good. Well, thanks, Manpreet. I'm glad you're asking all these questions. For everybody else in here, please submit some questions. Take advantage of me. This is free. You know, you're getting someone who's been through the process, giving you free answers that's going to help your life. So, submit as many questions as possible. It's not going to hurt. How should I read and improve? Okay. Uh, every using your doing third. Like you have to the first as well. My, um, fast. Okay. Uh, over the nose. on mature, and I've gone through it. Oh, that's where if you're you'll get you know um, they that's oh academic. Just so all right. So that helped folks. Right. Uh, you have that where now like oh quite throw yourself into you resource. And again, being there forget it. Yeah, I mean, source that like I just gotta think of this funny term or like acronym or like abbreviation, and now I'm gonna remember this just for memorization's sake. So if you're trying to focus on long-term retention, like I don't know how useful it is. I'm not a big fan of DIT. You'll notice people who want to do really well on the boards, they want to master the material. They don't want to just worry about I want to memorize and get it over with. Because the thing is, you're going to be using all the knowledge from step one, come step one and step two. And it could down to hurt and the because literally thinking about residents. I did email you. I mean, like at this point, uh, I can't motivate anybody. If your heart's not set on medicine already, then that's up to you to figure out. You know what I'm saying? Like, because the thing is, the students that I'm able to help are the ones who are already ready to give 110%. Now, if this is discouraging, it's supposed to be discouraging. So it's actually very, very natural and normal for this process to be discouraging. That's what helps you grow. It depends on how you look at the discouraging factors, because more times than not, you have a lot more failure than you do success with the USMLEs. Like a lot of the times, it takes like 7 or 8 different exams and a lot of studying in between where you're just failing all of them until you finally start passing, and that you don't start passing until you've really mastered this stuff before. So a lot of the reason people get discouraged is because they don't work hard enough, and they're not consistent enough, working 7 days a week, 12 hours every day, and like really putting in work to know that you're going to master the material means you're going to fail more times than you fail when you're not working as hard, and that's where if you start looking at the failure as a normal process and you start looking at the failure as a necessary part of learning, then the struggle becomes your greatest strength because you realize, yeah, I'm here to struggle. That's how are you supposed to learn? Like, it seems hard when you're just doing this for exams, but when you're in residency and like this is between a life and death situation and you're the doctor and the nurses are like, hey, do I give epinephrine right now? And you're like, holy shit, like, I don't know, that's where it's like, you could either kill that patient or they can live. Now, you're never going to be ready to make that decision unless you actually are getting through this struggle, So again, I'm big on like, you have to be self-motivated. Like you have to be like, hey, I want to be a doctor. If you're discouraged, I want to ask you here, what is your why? Why do you want to become a doctor? And answer that, please, man, because I think it'll help you understand like what's going to help you get through it. Because if you don't have a why, if you don't know why you want to become a doctor, it's because mom and dad want you to be a doctor, or like it's some superficial reason. That discouragement is eventually going to lead you to quit. And I've seen many students quit, and I don't hold it against them anymore because you're either cut out for this or you're not, and it's the thing is like, what's your why? My why, I love helping people. I love being of service to people. And like, if that means I have to work harder to be able to be of service, when someone comes to me and they're crying and they're like, you saved my life, you helped me so much, thank you. I'm like, hell yeah, all that shit was worth it, and like all the struggles, all the tears, blood, sweat, and tears was worth it. And every time I got discouraged, which I did, I told you it's a normal process. Every time I failed, I had to stick to my why. I had to know, why do I want to do this? Because if I don't even know why I want to do this, eventually I'm just not going to do it anymore, right? So Manpreet, that was the last question that we had. What's your why? You can answer here. It's probably going to help you as well, It's very, very important that you hang on to that why and that you step your work ethic up. A lot of the students, they're not working as hard as they should be, and then they play victim, and it's very easy to do that. I was once that student who I didn't know how hard I had to work. And when I wasn't getting the results, and it would lead to anxiety and discouragement. But I didn't know how much of that was in my lack of effort, And when I started focusing on my why and I started putting in effort, no matter what I was getting, that's when I started doing better. That's when the anxiety started decreasing. That's when discouragement looked like an opportunity, and that's when eventually I started breaking through, And I've seen students go through that and they break through eventually too. So, and so can you. It's completely possible for you, but it's not going to be possible unless you're willing to accept that struggle. Like, you will never become a good doctor if you don't struggle, if you don't fail. Like, the more you fail, the better doctor you become, because the more you can learn from each failure, the more trial and error you have, the more seasoned you get, Like, again, how does a surgeon become so good at a particular procedure? That surgeon does it 10,000 times. That surgeon will do the same procedure 10,000 times. And every time they do that procedure over and over, they learn from their last time they did it and they simplify something, And they're always on this gradual improvement. They're going to have failures. They're going to have procedures that didn't go as well as others. But if they keep going, it's the repetition and the consistency that allows them to, use discouragement as an opportunity to just get better at what they do, right? And that mindset is so important, because if that mindset leads you to victimize yourself and be like, no matter what I do, it's not enough. This will never happen for me. And now you're just going in this negative thought process, and then you don't even study that day because you're in such a negative place. You're crippled at that point, and that's where the why is important and the work ethic is important, And then let's see, hold on. Yeah, Manpreet, to help people, especially rural areas. So, again, that's kind of like, for me, that was my biggest thing is, how do you actually put yourself in a position to help others? Like, you really have to have gone through the struggle yourself. You really have to have mastered material, even though you don't feel like it, and like you really have to fail more than all the beginners ever have. Remember, there's a quote, it says the master has failed more times than the beginner has ever tried, right? It's because after a while you realize failure is important, struggle is important, discouragement is important, because if I keep going through that, that's what allows me to use all that frustration towards working harder and better and smarter, So um, you're going to have to hang on to your why. You're still in the beginning stages. It's easier to get discouraged in the beginning stages because you really feel like there's so much left. But, if you stay consistent, you eventually follow through. You're going to get past the beginner stage. You're in the middle stage. You're going to get past the middle stage. You're in the final stage. And I'm going to be there to help you through every stage. And I've been through every stage. And I've been through every emotional roller coaster in every stage too. So anything I'm telling you, it's something from experience. It's not something that is just superficial, and I do understand how you feel. I've been there. Just at one point you have to learn to use that as a strength, not a weakness, and you have to realize that this process, it's meant to break you. It's meant to really make you question yourself and your life, because a lot of people, if they just break, they won't keep going. Like, they don't deserve to be doctors because break, but then every time they always, there's this down the best version of, but wait, but you so residency questions poll at the end. There's one more poll. It's just to see if you guys actually found this useful. So let me see here. Where is it? I don't even know where it's at. I'll just add it. So, oh, here it is. Did you find this webinar useful? All right. Now I'm going to submit it. It's been published. All right. So I just published a poll that just asked you if you find this webinar useful. And if you end up voting no, uh, leave some constructive criticism. Put it in the chat. Be like, hey, I didn't find it useful because A, B, C, D. So then I know next time how to improve uh, and how to be able to help you further, right? So, yeah, please, guys, just vote if you found this useful or not. And it helps give me a little bit of feedback on what I need to improve on as well. And Manpreet, yeah, I mean that's what I'm here for. I am your academic advisor, and your job is to take advantage of me. You got free advice from me, so and I'm there. I want to be able to help you guys because I just wish somebody was there to help me, man. It would have made my process a lot easier. So the least I could do is help you and live vicariously through it because it helps me heal the trauma. All right, guys. Looks like most of you guys voted, and 100% of you said that you did find this webinar useful. Again, I do this webinar every month, so it would be best to just log into this webinar and to ask me questions directly through here. It works a little bit faster than email, but I'm there for you guys. In the emails as well. So I hope to continue to see you guys. Help me help you. Keep me up to date with your progress. And let's get these 240s and 250s. All right, guys. Many blessings to each and every single one of you guys. Thank you for spending time with me. Thank you for asking me the questions and making this an interactive event. I really do appreciate it. All right, guys. Until next time. Also, when I end this webinar, it does go on CMU's YouTube channel. If you type in Caribbean Medical University on YouTube, you can subscribe to CMU's YouTube channel. All the webinars I've done in the past are there for free, so you could just watch them if you need motivation slash vision, or something that helps you kind of understand where to go. Because all these webinars so far, everybody 100% has said that they're useful, so I know that they do help. All right, guys. Many blessings. Until next month, you guys take care, work hard, stay med-spired. Lastly, follow Medspiration. I founded Medspiration my first year of medical school. We reach over 3 million people a week now. If you look Medspiration up on Instagram, we have like, I don't know, 231,000 followers now. We're on YouTube. We have like 70,000 subscribers. We're growing. I'm always putting inspiring content out there, and it's always related to the mind, body, spirit. It's always medically relevant for medical students and for doctors. So, shout out to Medspiration. Follow Medspiration on Instagram, YouTube, Facebook, and Twitter. I'd appreciate it. I appreciate the support. All right, guys. Thank you so much. Until next time.